Good morning, everybody. I'm Helen Stubbs from the UK Department for International Trade, and I'm very pleased to present our first UK company pitch this morning and welcome Amer Fasihi, who is CEO and co-founder of Kraydel. Over to you, Amer.
So, thank you very much, Helen. We are Kraydel, and we've designed I'd like to talk to you this morning about the TV-based remote health and well-being platform that we've designed for use with older adults. We are a London and Belfast-based company. We've been in operation for a few years, so we're quite young, and we are now starting to go out into the market. And as you see, I'm going to take you through our product and some areas where we're working, and I'll welcome any questions and discussions as we go forward. So, our system. We've developed a system that we call Connect, and it has three components. It is a TV-based system. As we said, we're the only TV-based health and well-being platform. We will work on any TV, and you can see on the left-hand side that the way the system is configured. We have a remote control with the green and the blue buttons, which signal yes or no. And the interface you can see on the screen there is simply one of questions, which have yes/no answers corresponding to the green/blue buttons on the screen. So as long as the user can read subtitles, they can use our system. There is no training required, and we've tested that assertion widely. We simply, when we're testing, we simply install the system, and it takes about 5 minutes to install. It works through the internet, and it connects to the HDMI port on the TV. We hand the remote control over to the user, and we ask them to start using the system. It's a carousel, so if you say if you say no to an option, then it just moves to the one on the right. So you can see here that it goes to messages on the screen. If you say yes, it will go into a caller directory, which will have photos of people that this person could call. The video camera is in the hub that sits on top of the TV. You can see that. It has a motorized shutter. So when a video call is starting, the shutter automatically moves away from the camera. When the video call finishes, the shutter moves back in front of the camera. What makes our system unique is that we have TV takeover, and the user, for most TV makes, does not have to change the HDMI source. So if I call my mother, the hub will blink. She just hits the heart button on our remote control. That takes her automatically to the video call section, and she can accept a video call there, and then we can talk over the phone. I call my mother using the smartphone app, and you can see the screens in the middle picture here. It's the Connect app. You can download it now from Google, from the Google and the Apple app stores. And it works in exactly the same way as any video calling app. You can tap on one of the icons, make a video call to the user's TV, and it's very, very straightforward. We have functionality around uploading photos and videos to the user's TV. What we're trying to do for the user is address the issues around anxiety, or perhaps just the aversion to using smart screens or using PCs. We use the TV because it's the most familiar screen in the person's home. Then finally, on the right-hand side, we have the dashboard. And this is really the way in which we differentiate from other video calling systems that are out there. We have the remote health and well-being monitoring system in place, and data from devices that are connected, and I'll talk about those in a second, that are connected with our system. Those devices can send their data to the dashboard, and then family and friends get peace of mind. But more importantly, I think, healthcare professionals, social care workers, they will get be able to access the dashboard as well, and they can monitor the person's health and well-being remotely. So that's a very brief overview of the system. The TV is what enables the social aspect of our offering, and that's what we think keeps the user engaged and happy to have this system in their home. What keeps the family happy and what keeps service providers happy, we believe, is the IoT platform that we built, and that's integrated in. And here you can see a few examples of some of the devices that we've integrated with our system. We offer the promise of the connected home, where you can have electricity, water, smoke alarms, and we're constantly expanding the platform, as you'd expect. These are all third-party devices. We do not manufacture any of these. We integrate through using the APIs that these devices have available, and our system can automatically work with them. We do some selection of the devices, so that when a user switches these devices on, they should have the capability to automatically pair with our hub, and that's what we make sure happens on our side. So that the user doesn't have to go through any steps whatsoever to integrate these devices with the system. We believe this really is an offering around the promise of connection and smart home. So we've got these devices in connected home. We've got blood pressure monitors, oximeters, etc. So if there was a shielding situation, for example, COVID, the two main symptoms are coughing and fever. The oximeter measures the cough through the blood saturation, and a Bluetooth thermometer can measure for fever, and so you can do remote monitoring for COVID-19 over large populations using the dashboard that we just saw on the previous screen. And then we also have devices integrated for well-being, so around sleep quality, so room temperature, that's the heat sensor there, and physical motion around the home. So we think that by combining social, which is what the user wants, they want to stay in much better contact with their friends and family. They want to be involved in how families share photos, videos. They want to be part of that, but they don't like using iPads or smartphones. The family can now send that kind of material to the TV, and what the family also get is this peace of mind by being able to monitor and manage the health of the loved one. And this is really around supporting independence and ongoing healthy living. We are currently working with a large number of trusts in the NHS. We're working with home care. So currently in healthcare, we have around 20 trusts that we're working with pilots, and we've got another 20 or 30 that we are planning pilots with. In home care, we're working with councils, but we're also working with private providers. We have Age UK and Alzheimer's Society working with us. To Age UK, we're hoping we'll make some events available so that the user can attend these events virtually. With the Alzheimer's Society, we're working to configure the system so it can work for people living with dementia, either the sufferers themselves or the people who are living with them. And then we're also working very closely. We're getting a lot of interest from other countries, such as the US, Australia, and then regions such as Southeast Asia. We're very thankful for the DIT and various other UK bodies that have been encouraging us to take our messages broadly. So finally, just wanted to leave you with the message that we're combining social with health and wellness. We are uniquely doing that through the TV. We're taking a very different approach to from big tech in terms of how we want to engage with our users. And we're hoping that through these kinds of meetings and these kinds of opportunities, our message will get out to people who'd like to talk to us about what they can do with the system. So I'll stop there. Thank you very much, Helen.